Hi there. Welcome to Anima T1D. My name is Alex. My son Miguel has type 1 diabetes.
My name is Matt. I am a diabetes educator. In this video, we go over what it means if you are positive for autoantibodies for type 1 diabetes. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team. Thank you.
Hi Matt. How's it going?
Hey Alex, I got your antibody screening results back. Do you have a minute to talk about them?
Sure. What did you find out?
Your blood test came back positive for 2 autoantibodies that we know are associated with type 1 diabetes. This means your immune system has started to attack the insulin-producing cells in your pancreas.
Does this mean I have type 1 diabetes?
This means that you could be in one of the first stages of type 1 diabetes. Let me explain. Type 1 diabetes develops in stages. A diagnosis of T1D happens in stage 3, which is when someone may notice symptoms of T1D and may become seriously ill. Most people in stage 3 need to start insulin because their pancreas doesn't have the ability to make much insulin anymore, causing a rise in blood sugars. But we can determine if someone is in the early stages of type 1 diabetes, years before any symptoms appear. As shown in the picture here, stage 1 refers to when people who have 2 or more autoantibodies but still have normal blood glucose levels. In stage 2 T1D, the body is starting to make less insulin because the immune system has destroyed more beta cells. Your blood sugar may start to run slightly higher after eating carbs, and with time fasting sugar also rises. Most people in stage 2 do not have symptoms of diabetes, and even with the slight changes in their blood sugar, their levels are in the prediabetes range. As I mentioned, stage 3 is when the pancreas' ability to make insulin is so low that the blood sugars are in the diabetes range. This is usually when a diagnosis of T1D is made. We know that nearly 100% of people who have 2 or more type 1 diabetes autoantibodies will eventually progress to being diagnosed with T1D in their lifetime.
Oh geez. So, because I have 2 antibodies, it's basically a sure thing that I am going to progress to stage 3?
The first step is to repeat the antibody tests to confirm the results. If you have 2 or more antibodies, then the next step is to find out what stage of type 1 diabetes you are currently in by testing either your fasting blood sugar, HbA1c, or a glucose tolerance test. We will start monitoring you so that we can catch any changes early to prevent you becoming ill.
What will those tests tell us?
The results will tell us how effectively your body is keeping your blood sugar in the normal range and which stage of T1D you are in. If your blood sugars are normal, then you are in stage 1. If your blood sugars are in the prediabetes range, you are in stage 2 T1D. People who are in either stage 1 or stage 2 should be monitored frequently so that we can continuously evaluate your risk of progressing to stage 3. How frequently depends on the age. Younger kids need more frequent monitoring.
Okay, got it. Should I use a sensor like Miguel does? So that I can keep an eye on my sugars?
You can, but you don't have to. Being in stage 1 or stage 2 does not mean you have to monitor your blood glucose like someone in stage 3 does. There are no clear guidelines yet on how long or how frequently people in stage 1 or 2 should wear a continuous glucose monitor. Also, insurance may not cover it.
What else can I do? I don't like the idea of sitting around waiting for a diagnosis I know is coming if there is something I can do about it.
For many years, researchers have been asking, how can we stop this? And have been doing clinical trials to find new therapies. The goal of those treatments is to slow down the progression through the stages and keep the body making its own insulin. Right now, one of those treatments, called teplizumab, is FDA approved to help slow the progression of T1D in people who are in stage 2 of the disease. Once your tests come back, we can talk about whether you are a good candidate for teplizumab. There also may be other drugs in clinical trials that might be right for you. We can talk about that. It's important to know that the research that has been completed has not found anything you can do yourself to stop or slow the immune attack on the beta cells. For example, changing your diet, vitamins, or exercise won't affect the type 1 diabetes immune process.
But if it turns out I am in stage 2, there is a possibility to try a treatment that can help slow down the progression to stage 3?
Yes, that's right. You may qualify for teplizumab, or you might be able to enroll in a clinical trial for another new treatment. All people in stage 1 or 2 also should monitor themselves for the symptoms of high blood sugar. Do you recall those from when Miguel was diagnosed?
Yes. He was drinking a lot and peeing a lot for months. He had started losing weight, which was weird because he was eating all the time. He then started getting really tired and did not want to go to his friend's house. One day he was difficult to rouse and started vomiting. That's when we knew something was really wrong.
Exactly. I'm glad you know the symptoms so you can watch for them and check for diabetes before you get really sick or go into diabetic ketoacidosis. If you are in stage 2, you might be on the verge of a clinical diagnosis, so you would want to watch for symptoms, even if they are mild, such as weight loss, increased thirst, or peeing more frequently.
Okay, so what is my next step? I hope I can help researchers to understand how to stop this disease.
As I mentioned earlier, the next step is to repeat the blood screening test to confirm your test results. If the repeat testing confirms that you have 2 or more autoantibodies, then we can get you scheduled for your first monitoring visit. At that visit, we can find out what stage you are in. Monitoring will continue as long as you are in stage 1 or 2. It is important to continue with monitoring because the risk of being diagnosed with T1D in diabetic ketoacidosis decreases from 30% to less than 3% for people who receive close monitoring.
Oh wow, I definitely want to do monitoring then. Thanks, Matt. I was initially very nervous when you called, but I feel better now. Let me make sure I understood everything. Type 1 diabetes develops in stages. Each stage is defined by the beta cell reserve and the blood sugar levels. Stage 1 is when you have 2 or more autoantibodies and normal blood glucose levels. Stage 2 is when the antibodies destroy more beta cells, causing the blood sugar to rise into the prediabetic range. Most people in stage 2 do not have symptoms. Stage 3 is when a diagnosis of type 1 diabetes is typically made, when you can develop symptoms of T1D including DKA. People with 2 or more autoantibodies are in the early stages of T1D. Nearly 100% of people in the early stages of T1D eventually develop symptoms and need to go on insulin in their lifetime. So knowing the antibody status and stage allows for close monitoring of symptoms. There are several ways to check what stage of diabetes you are in, including A1C, fasting blood glucose, or a 2-hour glucose tolerance test. Close monitoring has been shown to decrease the presentation with DKA from 40 to 60% to less than 3%. Knowing the stage also helps identify if you are eligible for any disease-modifying therapies, some of which are FDA approved and others are still being investigated.
You summarized that perfectly, Alex. Would you like to schedule a time to repeat your blood screening test so we can confirm the results you got on the first test? After that, if the results are confirmed, we can schedule an appointment to figure out what stage you are in.
Yes. Let's do it. We hope this gave you a better understanding of what having type 1 diabetes autoantibodies means and the different stages of type 1 diabetes.
Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Don't forget to like and subscribe to our channel. Thank you.